Okay. How do we tell we're live? You
We're
just know how
live.
to do that. We're
Yeah, we're
live.
live.
Woohoo!
We're live.
Yeah.
Great, great.
I don't feel dead.
All right. Well, welcome everyone. This is Dietitians Thriving in Private Practice, where we share our collective wisdom about creating a private practice and get inspired. And I am Catherine Dittman. Joining me today is Stephanie Brooks. Stephanie is the owner of Bay Area Nutrition in Campbell, near San Jose, California, where she and her team of dietitians offer nutrition therapy to teens and adults with eating disorders and a non diet approach for the management of other nutrition related health conditions. Welcome, Stephanie. I am so pleased to have you here today.
I am so honored to be here, and thank you, Catherine, for reaching out and asking if I could do this. It's kind of nice. My hope is that maybe this is a little bit of a way of kind of giving back to our community because, being in private practice is hard. It can be very isolating. I have the benefit about as far as owning a group practice, so I do get to interact with other humans, like other coworkers, and then we have meetings, and I do supervision with them as well as offer that for other folks. So I feel like I'm getting that social piece and that kind of support that's hard sometimes because it can be really isolating.
Right. I agree with you. Those of us that are in sort of a solo practice have to do that extra effort to keep reaching out and, say, oh, I'm still here. I'm still alive.
Yeah.
Remember me, right? I know that locally we have some pretty good networks for doing that, which I appreciate. You and I have known each other professionally for some time, but I don't know your story. I don't know how you got started. Before we got on air, you mentioned that you've been in private practice since 1999. So maybe
25.
Yeah.
25 years, actually this month, 25 years, which my brain and body are like, no, I'm not that old. But that's a whole nother story that I'll work with my therapist about. Anyway, but yeah, it's kind of nuts. So January of 99. So I imagine there's a fair amount of folks who weren't even born yet, but and as my kids like to point out, that I was born in the 1900s, right, Mom? And I'm like, yeah, I was. Anyway, so I had dabbled. I've been a dietitian since 91. I dabbled in consulting with people here and there, and I was starting to get, like, back then, first of all, there was a phone. I had my first cell phone. It was a flip phone, and I had a Palm Pilot. That was like my tech. And then I had like a Performa, which is an old Mac desktop that, you had to, I think we still use the hard floppies. Yeah. And it was dial up. Mm-hmm. So there was kind of no internet. Anyway, it was wild. But basically, I dabbled and I thought, you know what? I really like this. I really like working with people one-on-one. I want to do more of it. Let's just jump in. And I gave myself 6 months to see if this would work. And because I'm like, okay, I'm going to drown in this. I can't. We can't afford it. I was married at the time. My husband was in grad school. His stipend, and living in the Bay Area, it didn't go well. So I thought, okay, let's see. Connected with a colleague, and she's like, yeah, I just rented a very small office. So the two of us shared that office. It was literally open the door, and there it was. Like, there we were. There was a little closet in the back / bathroom that we could store things. So there was no waiting room. So she and I were there like every other day. And our practices started to grow. And so, like, late summer, fall of 2000, we needed more space because both of us were like, look, 2.5 days isn't enough. So we were looking for places, and we couldn't find a place that was big enough to house both of us. We found like giant places or kind of tiny places. So I went ahead and moved out, and then I knew we had a need, and I also knew I wanted to start a family, and I knew I only wanted to see clients a certain amount a week, like only a few days a week. And I had a greater need. So I actually hired my first dietitian kind of late 2000 was the first one. So yeah, that's kind of how it started. And I was sharing, I don't know if y'all can see that plant back, again, wherever that plant is. That plant, I forgot what we named him, but he has been my plant since I started the practice. My daughter has revived it multiple times, and it's had babies. And so that is like, I'm like, oh my gosh. So I'm kind of wondering if the plant dies, does that mean like time for me to retire? Maybe that's a sign. We'll see.
I think that's a testament to your ability to continue to nurture both your practice and your clients. Right.
Yeah.
Yeah.
And one of the things I really love now, so a couple things has changed as far as our group goes, and we can talk about that if you want, but I'm really, really liking to train dietitians. We have a specialty in, eating disorders and actually sort of a values-based counseling. And so one of the things, because I'm like, okay, I'm 55. I'm not going to be doing this for the rest of my life. And that's good. So I want to like get people to like, come on, let's come do this. And so that's one thing I love about our team now is like being able to work with them and supervise and build them up. And then I also run some other supervision groups outside of our practice, same thing, and do business sort of coaching, if you will, consulting as well. So that's kind of, I'm like, okay, this is it's impressive because way back when there were no eating disorder dietitians. And Catherine, I know you know that.
No.
It was like, shaking the bushes. Anyone out there?
Yeah. Like 5 of us at one point. Yeah.
Yeah.
Mm-hmm.
Yeah. So anyway, yeah.
Yeah. And so taking us all the way back to the very beginning, did you start out working primarily with eating disorders, or did that sort of evolve? Okay. So how did you come upon your specialty and then create your niche?
So during dietitian school and my internship, and at the time I was at Berkeley, go Bears, for the rest of you out there, there was a coordinator program. And I remember the week we studied, like there was always like a disease of the week. We studied eating disorders, and they were like, okay, you just give them, like, that was when we were doing ADA exchanges, you give them like a meal plan, tell them how much to eat. You don't talk about food, feelings, any of the stuff. You leave that up to the therapist. And I raised my hand and I'm like, so that just doesn't seem like it's going to work. And I kind of got the sideline look from my instructors of like, shut up, Brooks. That's, just, hunker down and do this kind of thing. And I'm like, okay. So at that moment, I decided I am not working with this population because that does not seem fulfilling and effective. And what was interesting, I'm thinking in my head, I'm like, okay, so when we work with other clients, people with diabetes, people with lipids, people, other situations, we talk about the food and feelings and the barriers. And I'm like, so why aren't we talking about, I'm not going to talk about their trauma, but why aren't we talking about the barriers and how this is hard and stuff with the eating disorder folks? So I was like, okay, whatever, if I'm not allowed to do this, then I'm not going to, because it would be really hard for me not to go there, because it makes sense in my brain. That's what you need to do. So basically, I also was really blessed. I don't know if any of you know Joanne Akeda, but she was one of the big persons involved. We're so lucky in the Bay Area. We had a lot of fat activists, a lot of the health at every size, Frances Berg, Deb Burgard, those folks were like all here. And I was lucky to be taught and take some classes by Joanne. And so she kind of showed me like non-diet and health at every size before we even had a name for it. And I'm like, well, this makes sense. So I was practicing that way with my clients and kind of like, well, can't we do this for eating disorder folks as well? Well, but then I'm like, no, because we're not allowed to talk about this stuff. So they kept showing up on my doorstep. And I'm like, shoo, go away. I can't work with you. I'm not allowed. It's like illegal. I don't want to go to dietitian jail. So I just kept saying shoo. And this one woman is like, I know you can help me. And I'm like, okay. So we worked. And then Ellen Herb was a therapist. She's since retired. And she happened to be the therapist with this client, and I would leave these like long voicemails of like, oh my gosh, I'm so sorry when I met with so-and-so. And I asked them to like, not just log like, how they're feeling and, hunger or full, all this stuff. And I'm so sorry. I hope I didn't step on your toes, blah, blah, blah. And the whole time she would leave these, like, you're doing great, do more. And then more people started coming. And I got connected with Jenny Mayhew, who's a local therapist down here, as well as Deb Burgard. And I would do those same messages like, oh man, I messed up. I talked about feelings and this and barriers, and we tried to troubleshoot things. And they're like, great, keep it up. So I was like really conflicted. And then Ellen was teaching, Ellen and actually Deb both were teaching some classes at the time. JFK University was down the street here in Campbell. And it was like an eating disorder certificate for therapists. And they're like, why don't you take this? Even though it's for therapists, we think it might support you. It was great. I had no freaking idea what a lot of the words were. I'm like, why are we talking about triangles when they talk about triangulation? I'm like, I don't understand. Like, is this geometry or what? Like, what's happening here? So I would then take one of the therapists in the class and say, I am willing to take anyone out to lunch if I can ask them questions. And then we did that. And then they asked nutrition. It was great. It was such a great learning opportunity because there was no trainings.
Yeah, what a great opportunity. Yeah, I think many of us at that time really learned on the job. I learned working at a treatment program, and subsequent treatment programs, and from other fellow dietitians. But, fortunately now there are so many great training programs out there. So, that's really nice. So I want to take us more into the present day, and something that is I was going to say a point of contention, but it's more of a point of discussion. Let's say a point of discussion in this group is insurance or no insurance. And, every state's going to have its own stuff going on. We know that you are successfully utilizing insurance. And I want to hear about sort of the trials and tribulations in that. The second thing is, again, each state has its different way that you set up your business structure. And it's like, sole proprietorship, LLC, P Corp, S Corp. And, every accountant is going to have their own advice for you. And we learned that when we talked to our bookkeeper a couple of weeks ago.
Yeah.
So caveat here, this is California based, but we can sort of extrapolate it and generalize it as much as possible. But give me the wisdom and the insight here.
As far as whether to take insurance or not, or how I came.
Or how you have sort of figured out how to nail that.
So it's been hard. I mean, I want to back up a little bit and say one of the things that has been important to me is to try to provide as much access to nutrition therapy as possible. So, and that's just a value I have personally, and our group, that's one of the things that we support. So it makes sense to take insurance. Way back when Medicare first, I remember being on a lot of legislative thank you stuff and going to like, DC and even Sacramento to fight to get, coverage for medical nutrition therapy. And I remember when it started and it was like, okay. And we were like, this is going to be great. We're going to do this. And all the other insurances will follow through and we'll get reimbursement for all sorts of stuff. We now realize many years later, there is, it's not as maybe great as what we envisioned back then, but that was kind of the impetus. And so first it was like contract with Medicare, and the rates are the rates. They are. Everyone can go look them up. They're different based on your county. And then when I would start to contract with different insurance companies, my brain was thinking, okay, if Medicare's paying this amount, private insurance companies that are making money, because they're all pretty much for profit. And if they say they're nonprofit and you look at what the CEOs are making, you're like, yeah, are they really nonprofit? But anyway, I'm like, they should be paying at least what Medicare pays or more. And so made a decision of like only taking contracts that pay what Medicare would pay us or more. And so there are contracts we don't take because they're honestly offensive, I think, as far as our community and our profession. And so, it's a drag because we have people who have those insurance and, we'll do the super bill and we'll do out of network. So that part it's hard for me to grapple with because it doesn't follow my wanting to be accessible.
True, but I bet that it coincides with another value of being actually taken seriously and being paid at least what your, bare minimum of what your work is worth. Right?
Well, and when I went and contracted with different companies, I would say, look, Medicare pays this. And keep in mind, this was years ago. This was like in 2000 or 20, I don't even remember, way back there. And I'm like, you need to pay me at, more than that. And they're like, whoa, and I would pull out some of the research and like, here's the benefits. And so keep in mind, back then you actually talked to a human being who kind of cared about you, and now it's like the insurance seems like it's a bigger machine. So I think it is harder. I don't even know if you can get a human being on the phone. Mm-hmm. Yeah. So I think on one level, I was lucky. There were not many dietitians taking insurance. And so it's like, look, you have to provide this as an insurance company, you have to provide this service because it's in your policy. So if you don't have a dietitian available, then you're going to have to pay, through their gap coverage and out-of-network fee, which is going to cost you more. So I'm willing to contract it with you for this much. So it'll be less than the out-of-network that you'll have to pay, but it's, it's fair and reasonable. So that's kind of how I started, and it worked. And it's, there's some insurance companies or their third-party credentialers or contracting, they're really not just dietitians, but they're really gouging lots of providers. So, yeah.
Right. Yeah. So that's what's so interesting, because here's what I'm gathering from what you're saying is like you did the negotiating on your own behalf and perhaps on your employees' behalf to get them credentialed and negotiate a certain rate. But if we go through some of these third-party credentialing, they don't go to bat for you necessarily, and they may either take a little bit off the top for themselves, or not. That they might just say, "This is your rate, take it or leave it."
Right. Well, and I think the thing is, they're not put up against a wall. So, for example, in the situation when I was doing contracts, there weren't many folks taking insurance. So now if I was to go to one of those companies and say, hey, you got to pay me this much, they'll be like, no, we don't, because we have 20 dietitians in the area to do the work. So we don't need you. And which is true. And from a business model standpoint, they would be stupid to pay me more when they have a bunch of other folks that they're like, yeah, we're good. Now, if, for example, let's say they don't have enough dietitians to provide the service for whatever reason, there's more people that need the service, or there's less dietitians to do it, or a combination, then that's where they may go, oh, wait a minute here. We need to contract with more, and we'll be willing to pay more. It's kind of that supply and demand from an economic standpoint,
Yeah, and it seems to be like what you just said, like that's how it should be. Like the competition should increase the reimbursement and all of that. But now it seems like the market is becoming a little bit saturated, so it's more of a race to the bottom.
Well, and I think that also depends. I mean, look at it this way. If I have like a bunch of pencils I'm going to sell, and, my special pencil, I don't know, also is a can opener or whatever, and everyone's like, ooh, that would be cool. And I price it too high, no one's going to buy it. And then if I price it too low, I'm going to run out of pencil can openers or whatever it is. And then let's say there's a bunch of other people that come into town and they make their pencil can openers, even if it's the same darn one. And I'm like, I'm going to charge $5. And someone's like, well, I'll charge $4. They're going to sell more. And so I would then have a decision to either be at the same or lower to stay in business. But then also it's like, if I'm having to pay $4 for my pencil can opener and sell it for $4, I might as well go work as a barista somewhere, because not to diss baristas, part of me would like that, but I think I would have a big coffee problem, a bigger coffee problem.
Yeah, I think that the issue is the middlemen being the third party credentialers and the insurance, and that we're not even supposed to talk. Like you legally are not allowed to talk about your rates that you've negotiated. Right. Nobody is. And so we don't know how much or how little anybody is getting reimbursed for the same service in the same area. And, that's, we'll leave that there. Well,
the nice thing, what I usually tell folks is like anyone can go look at the physician's fee schedule for Medicare and look at their county, what nutrition therapy is reimbursed at. And so how I get around saying it, I kind of go, oh yeah, I get paid, somewhat more than Medicare rates, or somewhat less, or a fair amount more, or a fair amount less. So I'm not giving numbers, but it's like a little like
you have a point of reference.
Yeah. So that I think is okay to do. But if you're like, oh, I get paid $5 more than the Medicare rate, well then, yeah. So we do have to be careful, because we want to make sure we're not going to breach the Sherman Act. And so anyway.
Yeah. So insurance is just a great big black hole. And
it doesn't have to be.
So the thing I want to say is that you've been doing this for so long that I feel like somebody who doesn't go through third-party credentialer and isn't working with one of these companies, Nourish, Faye, Berry Street, we're all aware of them, right? And is really wanting to do it on their own, is going to have a harder time. You fill out all of your application, you're so excited, you take all of that time, and then say, I'm sorry, we're closed to dietitians in your area, right? Based on your zip code. You know what I mean?
To me, I kind of want to call, what on that, BS on that. And this is where I would encourage people to really do the research. Go look, okay, who are the dietitians within the radius, and what are their specialties, and like how available are they? You're like, hey, I work weekends, I can provide that. Or if they're like, all the dietitians in network are like, yeah, I only have room to take one more person. It's like, okay, then they're not saturated. So this is where you might have to do a lot of digging around, because I think the insurance company is always going to be like, nope, no. They have it does not benefit them at all to contract with you at a better rate. If you think about that.
Right. Yeah. So no matter how you look at it, working with an insurance company is going to be a lot of work for a lot of us, especially if we're in a market like I'm in San Francisco. Probably is pretty hard to get on a panel without doing the legwork that you're talking about.
Yeah, and I think that's the other thing is I think a lot of folks they'll get nervous about, it is. I mean, I was persistent, like, that knocking on the door and like, hello, I'm still here. Hello, I'm still here. And okay, if you're not able to help me, then who's above you, and just keep like kind of like that, they say like, what is it? The squeaky wheel gets the grease. Mm-hmm. I was an annoying wheel, like screeching, grinding, squeaking, like, yeah. And I think that's a lot of my personality. For those of you who know me, I'm kind of a bulldog and don't like to let go, which is good in some situations from an advocacy standpoint. My husband, however, may disagree that, my bulldog approach and not letting go isn't necessarily helpful from a relationship.
The disappointing part about that is that, you can do all of this work on your own, but it's not creating systemic change. And then I know that you've been doing advocacy for systemic change, and then that's not happening. And my goodness, how disappointing. So let's transition now and talk about this California medical referral. I know we are different on this. We differ on this. So for those of you that may not know, we are required by California law, like really by law, to obtain a written referral to do any kind of nutrition therapy. And when I dig around and try to figure out like how far does this extend, it sounds like that even means if you're doing intuitive eating with somebody, you need someone to give you permission. And then you've got this whole, cache of people that are not dietitians that they just go ahead and do it, right?
Yeah.
And
they shouldn't.
Exactly, but they do, and there's no oversight. And so I feel like we are bound in this little box. It is incredibly frustrating to me. Yeah. And so let me ask you a question about, let's say you've got a young woman, she's got a lot of medical trauma. She doesn't have a therapist. She hasn't seen her primary in years, and she doesn't want to go. And she's like, I need help. I'm super motivated. Can you work with me?
So here's where, like, I'm a rule follower in certain areas, and then I'm also one that will push the edge or push the boundaries. When it comes to like lawsuits, fines, losing my credential, going to dietitian jail, which I know is not really a thing, I'm going to follow the rules, because if I lose my credential, that's it. Not just for me, but for my situation, my practice. I mean, it would have a big effect on all my employees. Also, personally, like, oh God, now what would I do to feed myself and blah, blah, blah. So from that standpoint, yes, I don't love it. I don't. There's parts of me that go, oh, I can see how this is sort of California's way of protecting its consumers by making sure that, willy-nilly people aren't just doing this work. You have to be a dietitian, and there has to be some sort of oversight, hence the referral. So because there's a licensure in the state, and we have fought that for years, and always like it gets batted down. I think this is sort of like what the state's like, okay, well then we have this. And keep in mind, the state of California is like all about like, we want to protect our consumers, protect our, residents of California. Now, in that situation, what I would probably do is kind of meet with a person or have a phone call, learn a little bit more, explain like, hey, we need this, and explain the why. Is there a way we can work with you to, even reach out to your physician to say, hey, a phone call or a video session, which might, be a little less traumatic, to say, hey, this is what I need. We also will reach out to the doc, and say, hey, this is what we need. This is the why. We've been pretty successful at getting referrals. However, I have an admin team, and they're kind of like, they have, that like their niche is doing that type of stuff. So they're well trained, and they also are very persistent. So that is a benefit about being part of a group practice, is you've got these other resources to help you out, so then you can do the dietitianing, because this other stuff is taken care of. So I know I didn't fully answer your question, but I would be too nervous from a liability standpoint, because there's, like, to me, there's so much to lose.
Understood. Understood.
Do I agree with it? No.
Yeah, I know. None of us agree with it. And, you know, unfortunately, I think in my case, at least, I only found out about this within the past couple of years. And I know that even more recently, other dietitians are like, wait, what? We have to do what?
Yeah.
Yeah. So people don't even know about it. And then, so I've got my system in place, and you know, unfortunately, sometimes you request this referral, or you have your patient follow up, and it can take weeks for them to actually fax you that referral. And it's to me, it's a barrier to care. But here's my question. Where's our practice protection in the state? So anybody that's watching here, guess what? You can work with anybody in the state of California, but you need to obtain a physician referral. Are you going to do that? Are you actually going to do that? And then if you don't do that, is there any jurisdiction for the state of California to come get you? No, probably not.
Actually, there is. If you do, yeah. So here's the thing, and this is why I want to be really careful, because it is like a lot, and we're supposed to abide by that. This is where, if somebody could be a client, a disgruntled client, whether that one you worked with or another one, it could be anyone who basically could make a report to the state and says, hey, so-and-so is a dietitian and they're practicing medicine without a license, because that's where this goes, because they're not getting referrals to see their people. And so then it's like, holy cow, and then you'll have, I don't know I'm not sure exactly what group it would be coming, and they're not going to just look at that. They're probably going to say, okay, we want to see all your notes. We want to see, they're going to investigate, and you'll do an audit. I have a fair amount of anxiety about this. I actually got audited years ago by the IRS, because how at the time I can't remember what, our CPA, he was putting something in like a different category. And we learned that wasn't like the right category. Oh, God, it was so long ago. So that sent the flag. And so I got to go and meet with my local IRS person with my binder. And it was a lot of prep work, because it was the audit was for a couple years back. So to go get all my stuff, and, some of it was like receipts just thrown in a, shoebox or something. Yeah. It was a nightmare. So I guess my thought is, make sure you have your ducks in line and all that too. Mm-hmm. Yeah. And the other thing is, those of you who take insurance, this is where, we'll get clients go, oh, I don't need a referral because I have a PPO. And it's like, well, your insurance won't require one. However, the state of California, you being a resident, you being here in California, whether I'm a California dietitian or I'm like an Illinois dietitian seeing you remotely, I have to get a referral from your physician, and it has to be a medical provider. So I think like nurse practitioners are okay, but therapists are not. There was an update. I cannot find this to save my life, but I did read that there was an update in like 2019 that added psychotherapists. Okay.
Yes.
Okay, that is something I will actually have my intern dig around and look up.
Yeah,
if I find anything, I'll post it to the group.
Yeah, I wish I could find that, but I was, down a rabbit hole, and I'm like, oh my God, here it is. And then I didn't save it.
Okay, so you think it was like 2019?
Something like that. Yeah.
I'm writing this down. Can write. Okay. Mm-hmm. All right, we'll see if I can. Yeah, if I find anything like that, I'll totally share it. But,
great.
Yeah.
Great. Yeah. So
it is frustrating. And I got to say, being a business owner, like doing business in California is really hard for lots of reasons, because then there's the whole state and the county and the city, and it's expensive and la la la. So it is hard. And I think even if you're a virtual dietitian, seeing clients, like if you're out of state seeing California clients, I really want to recommend, like, you do your due diligence to make sure you have your ducks, in line, I's dotted, T's crossed. Because, if you get, even if you're in a different state, if you get pinged, I mean, my worry is, then does it go to CDR? And is it like, okay, you illegally did the service, we're taking your credential, or your malpractice insurance. So then now you can't get malpractice insurance because, you did a bad thing. So yeah.
I know. And I'm going to say something probably not so great, but it's like, oh, you lose your credential. Guess what? Now you can just be a nutritionist and you're not bound by any of those laws anymore. So it's like,
well, that's not true, because
I know that's not the case, but that's kind of how the rest of the,
but technically,
that's how we do. That's
yeah.
how we do it. And
well,
then
you have to
be dinged for it.
But you have to be a dietitian to do nutrition therapy, to treat someone. So the nutrition coaches or the, nutritionists, some are awesome and amazing, and don't get me wrong on that, but it's like legally, whether they're charging insurance or charging self-pay, it's like, you can't work with certain people who have a disease. So, as an intuitive eater dietitian, or let's say an intuitive eating coach who's working with somebody who has disordered eating, no bueno, because that's not okay. Yeah.
Right.
Yeah.
One other question before we wrap up here, back to insurance and the difference between medical and preventive.
Oh gosh. Okay, what's your question?
So I know that every insurance company is going to have a different way that they're going to deal with that. It's going to be a different CPT code, a different combination of preventive diagnoses. Do we need a referral for preventive?
Yes.
Yes, that's what that's my understanding too. I wanted that to be very clear for everybody out there. We need a referral for preventive.
Because you're preventing a disease. So whether, let's say I have a diagnosis of prediabetes. The work
we don't have a diagnosis. There's no diagnosis. They just want to. I just, I need nutrition education for healthy eating. Can you help me? Maybe I want to lose a couple pounds. That kind of person.
So there has been actually some cases in this state where nutritionists or dietitians have done, for like the O word or weight, and that's considered nutrition therapy, and under the arm of like, okay, you're trying to treat a disease, even though a lot of us would disagree that, weight, different sizes is a disease. But so it can come back to that. So, I mean, here's the thing is
right? It's a gray area.
I think, like, if somebody came to you and is like, hey, can you educate me on sources of calcium? Okay. Can you, can you help me brainstorm some ideas to like pack some lunches for my kids? Like, there's no medical stuff, but it's like, can you help me with some calcium things because of osteoporosis? Or, I really need some help to pack meals for my kids because one of them has ARFID, or one has, type 1, or, what it's like, well, so it's like it's like, you got to really look back. Where's this backing up the truck and going, okay, what are we really doing?
Okay. So let's say you had someone that said, I want to try to bill my insurance for this. Maybe they're out of network, and you're like, okay, how would you code that as CPT? Because it's not medical nutrition therapy. It's basically nutrition education. And what kind of diagnosis would you put on so that they could put the super bill in?
So, okay, so let me ask, what would be the situation? Like, give me
So
that, like,
like when
what
they're
would the
coming to you and they're like, yeah, I don't know if I'm eating enough. And, I feel like I'm always thinking about food all the time. And, I'm kind of not connected to my hunger cues. I just need a little bit of advice here.
Mhm.
I don't have any diagnosis, no eating disorder, not even subclinical eating disorder, but it's like, this could get bad, right?
So we can't diagnose.
Right. No, I know. That's what I'm saying.
Yeah. So without a referral with a diagnosis, I can't give a super bill.
Not even a Z code?
I would be nervous. I mean, oh gosh, Catherine, I don't know. This is where honestly, I think talking to everyone's like malpractice insurance, perhaps even talking to the insurance. Well, actually, this would be a super bill. So you wouldn't talk to your insurance company. I would think to be safe. Yeah. Oh, that's a good, really good question. And I don't have the answer. So I would say look at malpractice. Like you can consult with your malpractice insurance and ask them. This may also be like talking to your attorney, like, where's the gray line? Because the attorney can go through and look through all the California code and go, okay, what does this really mean? And give you advice on, where's the black, where's the white, and where's the gray, if that makes sense. So I think that's like a higher level question that.
So here's my conclusion here. We need licensure. We need licensure.
It would help.
We can make these decisions on our own because other states with licensure, they can do preventive. They can say Z code, got it. Yep. Intuitive eating, got it. We cannot do that. And everyone else who's listening, if you want to work in California, you cannot either. Right. So yeah, this is a national frustration. How do we get licensure? What do we need to do?
So over the years, and keep in mind, so I've been a dietitian since 91 and was very active on the legislative part of the California Academy, or back then it was CDA. We have put up many times on, in front of the state legislature, like, hey, we want to have licensure for dietitians. And usually it's the chiropractic and the nurses associations that fight it and knock it down. And this is where, politics is money. Whoever has the most money wins, and which is totally like that. I can talk about that, but I don't think that's right, but that's the reality. So if we think about, okay, what is our California association? How much money does CAND have to fight this? And then also, we have a lot of really good dietitians volunteering their time and energy and unpaid, and which, was, great that we were all doing that. Some dietitians, they don't have the capacity to say, yes, I can work on this X hours a week or whatever, or I can go to Sacramento and I can meet with my people, my state senators and oh my gosh, assembly people. Some of us don't have that ability and okay, or the money to pay lobbyists. Oh, okay. So what you have is a smaller group fighting. It's like, what is it, Daniel Goliath, like fighting but not necessarily in the Daniel Goliath, how the outcome is. It's like the California Nurses Association, much bigger, much more money. Mm-hmm. Chiropractic Association, much bigger, much more money. Those two fighting it, it's like bam. So that's where a lot of the issues have been as far as us, our state.
Yeah, I bet if we could document actual patient harm to these policies and undue hardship on the practitioner out there trying to do their due diligence to get the referral and do all this stuff and all of the inconsistencies and, have the lack of clarity, right? Mm-hmm. Then we might be able to make some progress there. But I believe patients are being harmed by this because I won't see you. I'll go ask my personal trainer, this nutritionist over there.
It could be, yeah. I don't doubt it. I don't have the evidence. That would be a great, hey, any like grad students needing a project for research, idea. The other thing is, I think, how many dietitians are part of sort of a bigger group? Because us individuals and us talking here, we're not really going to have an effect. But if we can, gather together and say, okay, this is what we're going to do, and do it in a strategic way. And I do like, where your brain's at, Catherine, as far as like, we got to show this data to people for them to go, aha, and unfortunately, usually somebody has to die before a new law or whatever is put in, which is like totally awful. But I think, also consulting with people who know how to do that. I mean, we're great at what we do. We are great, but I imagine there's not a lot of us that understand how to work the whole political legislative stuff. I learned a lot way back when. But I guess my thought is like, okay, how many dietitians who are being affected by this are members of the California Academy of, Nutrition and Dietetics. So, I mean, on one level, it's like, okay, we can complain about it, but if we're not doing anything about it, then, it's kind of like if you didn't vote, can you really complain that somebody is in office, kind of thing.
Right.
So I want to encourage, if this is something that's important to you, not just you, but anybody, kind of what can you do about it? And the individual, like collective work and energy is going to be much more effective than one person.
Yeah. And I'm thinking of what Jessica Setnick, who, for those of you who aren't familiar, she's an advocate for eating disorders, and she was working on gathering some data from individual practitioners about non-coverage for eating disorders. And I'm not sure where that process is, but she sent out a big email blast, and we were all supposed to give her our experiences, and she compiled them all. So that might be a way to go. Okay, we've gone a lot further than we normally do in this group.
Okay.
Discussion, and I think that you have access to a lot of knowledge and history of this situation that other people don't. So it's very valuable. And I so appreciate you coming and sharing this time with me. Thank you so much, Stephanie.
Oh, thank you. I thank you. And then those of you out there, thank you for, watching, or the future watchers. Thank you for that. And yeah, if anybody has questions, can I go ahead and share my email? Is that okay? It's sbrooks, so SBROOKS, like you see on the screen, at bayareanutrition.com. The website's bayareanutrition.com. So if, anybody, I also love helping dietitians like start their practices or even scale, or, anyone's like, I'm thinking about doing a group, happy to consult on that. Just, drop me a line.
Awesome. Yeah. Reach out to Stephanie if you need help. Absolutely. Especially if you're a California dietitian, because she's going to know the ins and outs and at least point you towards who can help you better than if, someone who may not have the local knowledge. So great. Well, thank you everybody for joining. Hopefully we'll have more coming up soon. I don't have a lot scheduled out, but I'm going to get on that by the end of next week. And hopefully we'll have some more interviews coming up. All right. Thanks, Stephanie.
Thank you. Take good care.